when a client comes to you, this is like basics of 101 of the initial case taking or observation procedure. How do you start conversing with your patient? Or what are the questions that you ask? What are the things that you observe? How do you note? Or just you just hear to the symptoms and then write the case? Or how do you approach that initial few moments?
So usually when I get a patient, I'll go through some basic idea. I can get it from the very first instance of when I observe him. Of course, and the patient will have a presenting complaint, the more which is annoying to him, that he will be explaining it, like pain or whatever it is, skin conditions or whatever it is. So that's the one criteria that for what reason he has approached me, that he wants solace in my treatment, that a particular thing is causing problem. For example, maybe skin condition with severe itching. So he will be going on the terrible itching, and it is causing trouble to his day-to-day activity and these type of things. So when a patient approaches me, that I'll go through his name. By the time I'll also get his somewhat an idea about his religion, and based on that, somehow his food habits I will infer. So based on that, then I ask a few direct questions regarding his work or occupation. Then I'll go for food habits. Then the presenting complaints, whatever it is there, I'll go by listing it, and then accordingly, then analyze it, observe the patient. So based on the primary criteria of Darshana, Sprashana and Spashnehi Pareeksha Roginam, this concept is involved. That is Darshana, observation, Sparshana, palpation and percussion and all those things if it is required. Then asking questions, numerous questions regarding things, maybe sometimes leading questions, or maybe sometimes to get the answer from him, to know the exact nature of his way of living. So many things comes into play. And of course, it's by your own habit and your experience, you will come to know that by seeing the patient many times, you can jump up the ladder, not even going for a routine questioning. Observation, you can come there. So based on that, once it is finalized, then you can analyze whether it is Bahudoshaja Vyadhi or Alpadoshaja Vyadhi, based on the duration of the lakshanas and all those things. How long he is taking this treatment with some other doctor, or how long he is suffering from this condition. So based on all those factors, then I decide whether the patient can be taken for Shamana or Shodhana. So once patient is suitable for Shodhana, whether it is a Vamana Yogya Purusha or Virechana Yogya Purusha or whatever it is, so once that is finalized, then we'll go for a planning. And then comes the role of patient. Then whether he is able to afford the treatment and all those things will come into play. If he is able to afford the treatment, then we go for that, and he has a time and everything for the purpose of Shodhana Karma. If it is not there, then obviously we go for a sharp acting and penetrative drugs with containing sukshma qualities in them, and such type of combinations are taken, and we will venture into Shamana things. Of course, Shodhana has to be done, and then we have to go to Shamana. We'll try to convince the many times patient gets convinced and they'll go for the Shodhana. But certain occasions, the patient may not be willing due to some other reasons, even financial constraints. So in that condition, then we'll go for the Shamana Chikitsa, then opt for the ideal Shamana drugs for that condition. That is the usual protocol what I follow.